Good morning, good afternoon, and good evening. My name is Alarco Ciesa. I'm the person at WHO headquarters in Geneva responsible for the rehabilitation program and also the lead of the Rehabilitation 2030 initiative, of which many of you are active contributors to it. So welcome to this training webinar on the Rehabilitation Competency Framework, where we will address the issue of adapting the Rehabilitation Competency Framework for specific contexts. And let me first of all remind you that we have captioning in this webinar and that you can access captioning pressing the close captioning button. And you have also two possibilities to be active in this webinar. One is with the question answers space, and you can access it also for the icon where please post all your questions. We will try to answer many of them during this webinar, and otherwise we will also summarize the questions that could not be addressed and send to all of you summarized answers. And but please, as many of you are already doing, use also the chat for making comments, welcoming other participants, or whatever you want to communicate to the rest of the participants. And now in terms of the topic of this webinar, and all of you are already aware that if we think of rehabilitation globally, the main challenge, or one of the main challenges that we face, is that the rehabilitation need is extremely high. And we know also that we can expect this rehabilitation need increasing over the next years, but at the same time, the capacity of countries to provide the rehabilitation services is low. And of course, this lack of capacity and this lack of supply of rehabilitation services in many countries of the world is related to many different factors. But one fundamental one is the lack and the shortage of rehabilitation workforce. And also, let me mention, is not only shortage, but also sometimes a question of quality of services and other factors. So that is what makes tackling and addressing rehabilitation workforce a priority if we want really to advance the agenda of having better and more rehabilitation services in countries to meet that increasing need. And the Rehabilitation Competency Framework can play a fundamental role to address that challenges. And because actually what the Rehabilitation Competency Framework can do is to make sure that the planning of workforce is done matching to the needs of rehabilitation, and this through different applications, supporting, for example, competency-based education, through competency-based regulation, through competency-based recruitment, but also the Rehabilitation Competency Framework can be utilized to address some other aspect of the workforce that has to do with the quality of the provision of services. We launched actually the week before last week, the Rehabilitation Competency Framework, and during that launch, we concentrated on why competency frameworks are important, what is concretely the rehabilitation competency framework, and what are high-level applications of and potential application of the rehabilitation competency framework. Today, we will hear about specifically about what is the rehabilitation competency framework, and then we will have an in-dive into the application and the how the rehabilitation competency framework can be adapted so that it serves specific purposes for specific populations. And I have to say, I'm extremely happy to see so many of you joining us to this webinar. And I also extremely happy of all the speakers that will be introducing this what and this in-dive into the how. We will have a brief introduction today on the what is the rehabilitation competency framework, and that will be done by Dr. Edward Lemieux. Then we will have a really challenging roundtable with elevator pitches, where experts during 2 minutes will explain different ways in which competency frameworks can be used. Then my colleague Jody Mills, who is also the driving force of all the work that WHO is doing in terms of rehabilitation workforce, will really present step by step how the rehabilitation competency framework can be applied and adapted. And then last but not least, we will have Stacy Baldick, who will really introduce good practices for adapting and for developing competency frameworks. Everything will be moderated by my colleague from the European region, Satish Mishra, who is the person who is leading the rehabilitation program in the European region of WHO in Copenhagen, and also responsible for many other health programs in the region beyond and about rehabilitation. It is a great pleasure, and without further ado, to pass the floor to Satish, who will navigate us now through the webinar. So Satish, then now to you, and looking forward to the next.
Thank you. Speaker. Thank you, Alerkos. And good afternoon, good morning, good evening to everybody. We have nearly 300 participants who have joined, and it's a great privilege to have all of you with us today. Without taking further time, may I introduce Professor Edward Lemieux, who is the ISPO President, International Society of Prosthetics Orthotics President, as well has been the Technical Working Group member for Rehabilitation Competency Framework. He's also a professor in University of Ottawa, and he will give us an overview on the RCF, the Rehabilitation Competency Framework. So over to you, Edward.
Yep. Hello, everybody. Thank you for giving me the opportunity to talk to you today about something I think is very important and actually a very comprehensive work, the Rehabilitation Competency Framework, or the RCF. And as I said, my part for this presentation is really going through who it's for and provide some of the background and expectations of what the RCF is going to deliver. So, what is the RCF? Really, we're looking at a description of how rehab workers behave. It's the competency, what they do, the activities, knowledge and skills, and all based on core values and beliefs. Really, what we're looking here more technically is a model that communicates the expected and aspired performance of the rehab workforce to enable quality care and service delivery. The big thing here is we want to articulate the core values and beliefs for the rehab workforce and the spectrum of performance across a range of competencies and activities. Define the underlying knowledge and skills that are needed by the workforce to deliver and to support this. And I find when we're looking at it, it really does all come back, which is interesting, to quality care and service. So even though sometimes you don't see specifics on one job in the framework, you can really see how it flows through to this end goal. So who is it for? Really, we're looking about this, it's for all rehab workers through the workforce. It's really designed for. It's not for one specific profession or length of education, or it can really be adapted for any rehab worker. The scope of what we call a rehab worker is also broad. Consider that any worker that delivers an intervention that targets function could be a rehab worker. We think of usually the regular core professions: physiotherapy, occupational therapy, speech pathology, audiology, prosthetist, orthotist, psychologist, rehab medicine physicians, nurses. But the composition really of a rehab worker around the world can be very different at many different levels, including people providing technical services as well as the clinical services. And really everybody, if you look, has a place within the RCF. RCF was developed actually with a highly inclusive and participatory approach with 5 main stages. Again, starting with a scoping review of the literature, because it's always good to start with the evidence, I think, in almost any project that we do. Content analysis of the existing rehab-related frameworks. A Delphi study, building consensus on the ideas that would go into the framework. Consultation with rehab service users, and we'll soon have health condition specific tasks integrated into the practice domain that Jody will talk about a bit later in the presentation. We had a technical working group of 20 experts that represented globally the majority of the professions and people working within the rehabilitation field. And also several members with a disability who have experience with rehabilitation services in their lives. Just to note here that a lot of the details that won't be covered are in these different publications. And I'm sure that the links you can get from Jody, maybe, I know it's up here on the slide, maybe we can post them in the chat or make it available to people, or you'll be able to see it in the recording. What does the rehab framework include? As we see here, a snapshot of the different domains which center around the core values and beliefs. Each have their own competencies, each have their own behaviors, activities and tasks, as well as their knowledge and skills. If we look at the core beliefs, as you can see here on the screen, this probably looks very familiar to pretty much everybody working in the field of rehabilitation. Permeates all we do and shape how we work with people and families, other healthcare workers, society, and the rehab process. Again, these aren't exclusive to rehabilitation, but they are person-centered, collaborative, oriented to function, and they characterize the full spectrum of rehab within these core values and beliefs that are the basis for the RCF. We have 5 domains that were included. Practice, which relates to the interaction between the worker, the person, and the family. Professionalism, related to the professional integrity, collaboration, safety, quality of care, enabling you to work as a role of a rehab professional or non-licensed professional within the field. Learning and development, which all relates to teaching, learning, maintaining your knowledge, continuing professional development as well. Relating to teamwork, strategic thinking, and the management, service delivery, evaluation, and resource management, and of course, research for the innovation, integration into rehab services. I think it's kind of important here when people sometimes think of competencies, they think of learning only. They don't think of the fact that there's the management aspect, there's the research, there's all these different domains. So I have to admit, as part of the group, I found this was very refreshing that we had a very comprehensive approach at how we look at the different domains so that we're inclusive of the whole spectrum of people and services that are needed to provide quality care globally. The domain structure all share the same components, which are the competencies, behaviors, activities, tasks, and the knowledge and skills of the workers. And all this is arranged within a series of tables within the document. One thing you might note is RCF compared to typical competency frameworks is it distinguishes competencies, activities, behaviors. As we look at this, really a competency sorry, I'm switching back here to my notes. We're associated with the rehab worker, durable, expressive behaviors are relevant, right? Activities are more associated with the roles and requirements in the scope, the beginning and end, encompassing tasks. So there's really where we look at the two different aspects. As far as levels of proficiency, RCF describes the tasks and behaviors over 4 levels. Each level progresses from level 1, where the person works under the direction of someone or under close supervision, with an introductory level of knowledge and skills, all the way to level 4, where the person works autonomously and has specialist knowledge and skills. The levels don't align with any specialization or length of education or training. In fact, workers may align with different levels in different domains, and it can change over the course of their career. The RCF also provides a proficiency profile at the start of each domain that paints the whole picture of the rehab worker at each of the levels. And again, you can see this within the document. Each domain describes the 4 levels in a way that is relevant to the specific domain. So each has its own proficiency profile at the start. In terms of knowledge and skills, at the end of each domain, the RCF lists the knowledge and skills and underpin the competencies and behaviors. So the knowledge is the informational basis of the competencies and activities. The skills are the motor cognitive abilities that the worker needs to develop the competencies and to perform the activities. So to conclude, I just wanted to be able to say that there are 2 guides that you should probably download and take a look at. They're on the main website. One focuses on adapting the RCF, which relates to training, and the other is using the competency frameworks to develop education programs and curricula, which we're going to move on with in the presentation. So thank you for the opportunity to go through and look at this overview, and hopefully this has set the stage for the discussions and questions later on in this webinar. Thank you.
Thank you, Ed. Thank you. Thank you for so eloquently describing the RCF in such a short span. For me, what really struck was the one sentence which you mentioned about that it's the model that communicates the competencies, current or aspired, to strengthen quality of rehabilitation services. I think that's the underlying principle behind it. Moving on, we'll move to the next challenge, which is itself titled as the elevator pitch challenge. And here I'll be joined by 4 speakers. And the challenge is that we have we have nearly 350 participants by now. And imagine that you're taking them on a tourist bus, and you are the tourist, you are the guide, the tourist guide. And in 2 minutes, you have to explain the importance of rehabilitation competency framework. And this tourism is all about competency framework, rehabilitation competency framework. So you're in the bus, you're driving the bus, you're going to guide us in next 2 minutes, why and what stands out for rehabilitation competency framework, and why as a participant, I should rely on it or I should use it, and how should I use it. So without taking much time, may I first introduce my first guide, tourist guide or competency tourist guide, Rochelle D. Rochelle is a physical and rehabilitation medicine doctor from US who specializes in working with children with cerebral palsy. She's also the chair of the education committee of the International Society of Physical and Rehabilitation Medicine. She will be pitching on how competency framework are used in the context of education. So Rochelle, your time starts now.
All right, greetings. So the competency-based, or it's also called outcomes-based education, is the emerging gold standard in an educational model. Wherein, as said earlier, the requisite knowledge and the skills are well defined from the beginning. It describes how a student should be able to behave, what they should be able to do when they graduate from a program. So this type of model has been adopted for the past 50 years already, especially in under medical or medical education, as well as in the residency training. Over the years, we've come up with milestones. So imagine, somebody, like a child trying to learn, steps to walk. So there are stuff like components, how to get there. So it helps define and break it down into much more detailed structures. The competency frameworks are a key reference when we develop curricula. They help identify the learning objectives and outcomes, which determine what the students are taught and what they're assessed against. It has the advantage to allow students to be able to learn at a variable pace. And it's not defined solely by a set number of hours or days or just the length of duration of training, but rather it is more learner focused. And of course, it's often learner directed. Unlike the traditional education wherein curriculum can be based on what has traditionally been taught over the years, wherein there's also a danger of becoming outdated or not necessarily be relevant to the current context, and answer to the current needs of the society or the industry. When the competency framework has been based on an assessment of population needs, they can help make sure that students who graduate are able to meet the needs of the industry, or in our case also the population that is being served. So therefore, there is a need for periodic assessment of the societal needs and then bringing it back to the training curriculum as a feedback loop. This helps makes the curricula dynamic, and also it helps ensure that it remains relevant. Thank you.
Thank you, Rochelle. I think what really stand out from me is that it is a basis or a reference for curriculum development. It helps to ensure that it is aligned with the learning outcomes and what people are going to learn. It helps us to be learner focused. And the thing which you mentioned about the loop of the assessing the societal need and looking back at the curriculum, where the rehabilitation competency framework plays a very important role in making that loop. I think these are very extremely relevant and extremely striking points. Right, thanks, Rochelle. Now I move to my next guide, competency framework guide, who's taking us on this tourist bus. Alison. Alison Douglas is an occupational therapist from Canada. She is the Director of Standards at the Canadian Association of Occupational Therapists and is responsible for managing the national entry to practice and accreditation of academic programs. She will be pitching and telling us how competency framework are used in the accreditation and licensing process. So over to you, Alison.
Thank you. So a competency framework defines a standard, and that means that everyone can be taught with a defined standard, as Rochelle stated so lovely, in such a lovely way, and everyone can be examined with a defined standard. So most importantly, this ensures that you get a safe and effective rehabilitation workforce. We know that poor quality care and poor quality workers are both dangerous to rehabilitation users and inefficient, as it generally reaps no benefit and could even cause harm. So how does the competency framework benefit accreditation and entry to practice exams? For accreditation, a competency framework means that there is transparency in education programs. Students and employers know what has been taught, and so they're getting what they're paid for, what they paid for. The public also benefits. Accreditation programs use the competency framework to ensure a high quality of education. For exams, a competency framework leads to fair decisions about an individual's entry to practice. It means exams can publish what is going to be examined. So all examinees get a fair chance, and the public has rigorous decisions about who can practice safely. A side note also that competency frameworks, when used with exams, will have more emphasis on what is measurable and testable compared to, for example, in education. So my 3 key messages: the competency framework defines a clear standard. The standard can be used by an accreditation program to promote transparency and high quality education. It can be used, and it can be used to run entry to practice exams fairly. So ultimately, this means the public can place confidence in the competency of the rehabilitation practitioners.
Thank you, Alison. Thank you. I think what really stood out for me was that it defines the standards of practice. And what you said is about the transparency in an education program, which helps us to identify not only for the student, but also for the employer and as well as for the public, what to expect from the rehabilitation professional. So the whole notion of transparency and clarity on expectation is really stood out for me. Thank you, Alison. With that, I move to my next Rehabilitation Competency Framework Tourist Guide, which is Pete. Pete is joining us from Armenia, where he's working at the moment, but I will explain more what Pete does. Pete is the emergency focal point for rehabilitation at WHO headquarters. He has extensive experience in emergency response and coordination, including for disaster and conflict in Haiti, Nepal, Mozambique. He's joining now from Armenia, as I mentioned. He will use these experiences to pitch how competency framework are used at service level. Over to you, Pete.
Thank you, Satish. And, good afternoon, everybody. So conflicts and disasters, and within that we include outbreaks, they create enormous surges in needs, and these needs overwhelm health services. And it's typically that we don't have enough staff that are specialized in the areas that are needed to meet the needs. So what we have to do is we have to retask staff at very short notice. But retasking creates risks. And even in an emergency context, clinicians, they still need to be safe, and they still need to work within their competencies, within their scope of practice. And do no harm in an emergency context should always be the first consideration. But we see constantly in emergencies that people feel pressure or a need to work outside of their competency, and that creates a risk of harm. So we see people doing dangerous things, or people not having the knowledge sometimes or the skills to spot risks or to manage risks as they come up, and that puts patients at risk. We've seen the challenges of this with coronavirus, where we face huge needs in intensive care, but you can't simply move the staff that you have from, let's say, a pediatric department or a musculoskeletal department to an ICU, no matter how high the need, because again, that creates risks. So having the competencies clearly established for the roles that people step into is so vitally important. It helps ensure the quality of care, but it can also help with recruitment and with the retasking, and it helps to show us where staff might also need training and supervision to be safe and to be effective. We also see this within the international sector. So a lot of my work is with emergency medical teams, and they're looking to develop their rehabilitation staffing. but sometimes they don't know where to start. And so having competencies established for them where they're non-experts in rehabilitation also will really help to ensure quality of care, which is what we're all about. And for this reason, we're actually planning to use the Adaption Guide as a network to build on humanitarian and emergency competencies for rehabilitation professionals. Thank you.
Thank you, Pete. Thank you. Very well said. And I think what really struck me was the whole notion about task sharing, task shifting, as well as retasking, which becomes such a huge challenge, especially in a humanitarian crisis. And how the competency can be established, which can help at a service level, but can help in the recruitment, but also the staffing, professional development, among others. Thank you, Pete. Thanks for that. With that, I move to my next competency framework tourist guide, which is Monica Mann. Monica is an associate professor at Johns Hopkins Bloomberg School of Public Health and has extensive experience in strengthening health system to integrate rehabilitation in countries in Africa, Asia, and Latin America. Monica will be pitching and telling us how competency framework can be used in the context of national workforce evaluation and planning. Over to you, Monica, for the next 2 minutes.
Thanks, Satish. Yeah, so I want to go over 3 key points in how the framework can be used in national and subnational workforce evaluation and planning. So the first point is, when we think about workforce planning, we think about the numbers of workers needed. And what's often left out of that conversation is the discussion of the competency of the workforce. And the Rehabilitation Competency Framework is important because it can assure us that the rehabilitation workforce has the knowledge and skills to meet the population needs. And the way it's been developed, it also is adaptable to both national and subnational levels, as well as for use in low and high resource settings. So that's point number 1. Point number 2 is that the framework can enable gap analysis of competencies. And so it can identify where there are gaps in competencies, as well as where there's maldistribution of competencies. And this is especially useful in areas where the rehabilitation workforce is still evolving, where there's not enough rehabilitation workers, because it allows us to develop strategies to assure that the entire population has access to the needed rehabilitation services. And the third point is that efforts toward achieving universal health care call for the health workforce to be responsive to population needs. So competency frameworks can facilitate educational institutions and regulatory bodies to work together to develop to support the development of rehabilitation workforce. And the findings from the competency gap analysis can confirm the necessity of workforce training and to plan that training. So it targets the area of the competencies that are needed. And lastly, and what's really important and sometimes left out of this is that the results of the network, the results of the framework can help us explain what's needed to policymakers and to develop the political goodwill to work toward the development and the strengthening of rehabilitation workers, bringing it around to why are we doing this to meet the unmet needs of the entire population, which is, as we know, is a growing unmet need in rehabilitation. So those are the 3 points in a nutshell for you.
Thank you, Monica. Thank you.
You're welcome.
And I think what really struck me was the point about the universal health coverage and how rehabilitation competency framework can also be a strategy of ensuring population access to the needed services. The other striking point which you said was about, it's not only about the numbers, but it's also about the quality. And that's where rehabilitation competency framework can play such a huge role. And thirdly, and something with which we work a lot, which is creating political willingness in the countries, where how rehabilitation competency framework can also help us to create that political willingness to ensure that unmet needs of rehabilitation are fulfilled. Thank you very much, Monica.
You're welcome.
With that, I think we will be moving to our question answer session. But what was clear for me, at least from the presentation from Rochelle, Alison, Pete, and Monica, is that Rehabilitation Competency Framework has a range of practical application at national and service level. And I think that message came out very loud and clear. Before we move to our next session, it's time to take some questions, which has been posted to me, and I have it now. And I will be asking that question to the people who has spoken till now. Let me start with you, Pete. Are competencies, rehabilitation competencies and activities relevant to humanitarian response included in the RCF, or would they need to be added during the adoption process? So it's a question to you, Pete, whether the competency framework already addresses the need for which are relevant in case of humanitarian response.
Thank you, Satish. I think that the competency framework as it is an outstanding foundation for what we need and can absolutely be applied in the humanitarian response. But as I mentioned briefly, I do think there is a need that we, as everybody in any particular area, would adapt it, and it can be adapted for organizations, it can be adapted then for countries or particular settings, or it can be adapted for an emergency. But there is work that we will do as a network, I think, to work on some general adaptations that we can use, because obviously we need to be prepared with a framework that's good for what we need prior to the emergency strike.
Right. Thank you, Pete. There's one more question, which I will address it to Edward. Can one framework be used by different organizations or stakeholders, or do they each need a different one?
Well, the nice part about the way this is structured is it's the competencies and the whole structure underneath, as we mentioned, as all the different frames, it isn't specific to any one discipline. So for an example, within ISPO, we have our education standards, and now that we have the rehab competency framework out, we're going to be looking at remapping rechecking about how our education standards in prosthetics and orthotics map back onto the rehab competency framework, just as a way of reevaluating where we are and how it fits globally within the whole rehab context. And so there's a good example of one area where this is done. We've already heard from other people here where they're able to take the tool and not only look, in this case, on education, but also when we start looking at, I like the point about service provision as a whole. Like, are we really within a certain region or area, is what's being offered for rehab services really matching the competencies as we kind of go through and benchmark. So the nice thing about it is it's has everything you need to do to be able to look and apply and evaluate what you have without specifically being written for any one profession.
Thank you. Thank you very much. There's one more question which is related with, which I guess, which I'll put to Rochelle and Alison maybe together, is are there applications for the rehabilitation competency framework that don't rely on it being adapted?
Don't rely. I think, yeah, so I think there are, the framework provides almost like a skeleton, I think, like a structure
Right.
for somebody to guide through. And then with all those, it helps you going from step by step how to process. So I remember when we were putting this together, we had to go back. We identified that, the core values are going to be the backbone. And so I think as it's being developed, it helps whoever is adopting it to kind of look through an overall and have a little bit more step-by-step approach. And I think, kind of going through it the exercise of it kind of, I think, unravels much more into how it will be carried out. So it is flexible enough, but at least I think it helps provide some of the step-by-step so that you're not kind of overwhelmed in terms of how you're going to be able to somehow adopt pieces of it. Because, for example, if you go down to the details of the activities and how they are assessed, competencies, how they are assessed, it will have to be very much tailored to whoever is adopting it. As we said, there's a lot of factors: the environment, the population, the need, and so on and so forth.
Thank you, Rochelle. Alison,
And yeah, just to add to that, I think there would need to be some consideration of local context, the historical context in Canada, the colonization context, the consideration about culture and how it influences education, tasks, the understanding of tasks, and the understanding, for example, of the competencies regarding relationship with families and clients. So I think there definitely would need to be consideration of local context.
Perfect. Thank you, Alison. And I'll probably take one more question. We are getting a lot of questions, but I'll take just one more, and if it will be good, we can have a quick response on that. I'll put the question to you, Monica, before we move to the next session, is how can individual institutes adopt this framework for building capacity in the countries where we don't have central regulatory bodies in the field of physiotherapy, occupational therapy, or other health professionals? Right.
So that is one of the beauties of the framework, is that it can be used at different levels. So it can be used, for instance, in university professional training programs for physiotherapists or physiatrists, or it can be used for training even like community healthcare workers in basic rehabilitation. So you can take the framework and use it at various levels. Now, ideally, it's great if it's coordinated throughout all the different levels of the health system, but it really has an advantage to be used even at one level, just to train a certain cadre of rehabilitation workers and improve their competencies.
Thank you, Monica. Thank you. We are getting many other questions, but we'll try to answer that and post it on the website. But I think it's a good time to introduce now my next speaker, Judy Ann Mills, who has been the real driving force behind the Rehabilitation Competency Framework. Judy is a member of the rehabilitation program at WHO headquarters. She was the project lead for Rehabilitation Competency Framework and the associated guides, and is currently developing resources to support rehabilitation workforce and evaluation in the countries. She'll be stepping us through the process of how to adapt Rehabilitation Competency Framework to create a competency framework for a specific context. So over to you, Judy. Thank you.
Thanks, Satish, and hi, everybody. It's fantastic to once again see so many people joining from the various corners of the world. For those of you that didn't meet me during the launch, I am part of the rehabilitation program at WHO headquarters. I've been there for about 6 years, and the last couple of those, I've really been focusing on the development of this rehabilitation competency framework. I have a much easier task ahead of me than the participants of that elevator pitch challenge had. I have the luxury of 20 minutes to guide you through a step-by-step process of how to adapt the WHO Rehabilitation Competency Framework to a specific context, so that it's relevant to the people and the places and the cultures in which it's actually going to be applied. I'll use the acronym RCF. I think most of you by now are familiar with that. It's a bit easier on the tongue, so you know what I'm talking about there. And just a reminder, we will have another Q&A session before the webinar closes. So if as I'm talking, you have questions, feel free to post them in there. If we don't cover them all during the webinar, we'll make sure we cover them in some other way via email or through the website. But let's dive in. The reason that we've devoted a whole webinar to the process of adapting the RCF to a specific context is because 9 times out of 10, it's a prerequisite to actually using the RCF in any kind of practical way. And one of those questions was, can you use the RCF in a specific context? As WHO, there are instances where we are actually using the RCF to help us develop tools that are really applied at a national or international level. But the vast majority of stakeholders will be using it for quite a specific context, and then an adaptation process really needs to be applied. So I will be walking you through that process. And the good news is that we tried to make that process as simple and as straightforward as possible. And one of the ways that we did that was through creating this guide that's available online in the same place that you'll find the RCF itself. I think the easiest way to get a hold of that is simply by searching or Googling WHO Rehabilitation Competency Framework, and you'll find your way there. But there is a direct link if you wanted to use that as well. And we'll be sharing this all via email afterwards, so hopefully it's very accessible to you. Most of you won't be going through the process of creating your own competency framework or modifying or reviewing a competency framework tomorrow, or even in the coming weeks or months, possibly. So the overview I'm providing will be a nice introduction, but when you come to actually doing the work yourself, circle back to the guide and have a little refresh of all of the phases and steps involved. Those phases and steps look something like the 5 that you see laid out here. 5 key phases of planning, drafting, reviewing, finalizing, and dissemination, which collectively encompass about 13 different individual steps. Of course, in practice, it's never this neat and tidy. We appreciate that, but it is nice to break it down this way because it gives us a chance to really highlight the key activities and practices that should occur if you're going to come out the other end with a competency framework that's really fit for purpose and something that you're really happy with. We're not going to have time to go into much depth in all of these steps, obviously. So I'm going to focus predominantly on phase 2, which is the drafting phase. And that's not necessarily because it's more important than any of the others, but it is the more technical phase, and it's the one that's most specific to the RCF. But let's start at planning, starting at the beginning. And anybody that has created any kind of product or managed a project will appreciate the importance of the planning phase. When we're talking about adapting the RCF, the planning is a lot about information gathering. You heard it said again and again through the launch and through this webinar that competency frameworks are an important mechanism for aligning the workforce with population needs. But they can only achieve that if the competency framework itself is really informed by population needs. So the planning should involve a nice assessment of health and demographic profile of the population so that you can understand what are the real health challenges that the people that your workforce is going to be encountering are facing, or what sort of trends are there. For example, is there a focus now on primary healthcare and community lived care that should be reflected in the competency framework, for example. And of course, the socio-cultural political context, all of that bigger picture environmental stuff, there's often a lot of history that needs to be acknowledged through competency frameworks. And of course, the needs and preferences of key stakeholders. These can be the rehab workers that the competency framework is targeting. It can also be the beneficiaries or the service users of rehabilitation, and sometimes other stakeholders like policymakers or people in the legal sector. And of course, you want to make sure that you're aware of what competency frameworks and standards already exist, whether they're at the national level or international level, and legislations and regulations so that you can make sure your framework is aligning nicely with those. The planning phase is also where you develop your plan of action. It's always useful to articulate why you're creating the framework, some of the background, but also, of course, your methodology and your timeline and who's involved and who's doing what. all of those real practical logistical questions can be addressed in the action plan. And also, of course, considering what resources you're going to need, human, financial, technological, it's best to make sure that that's all in place to start with so that your process isn't derailed partway through a lack of resources. And finally, it's nice to have a working group sort of guiding and inputting into this process. This group can be big or small, but generally includes people that represent the types of workers that your framework is targeting. And it's a nice place where minority groups in particular can be represented, and you can make sure that their voices are being heard. We have some annexes or some templates for things like the action plan, and that can help with establishing a working group in the annex of that adaptation guide, just to sort of help you along with the process. But jumping into the actual drafting phase, one of the key questions to address at the get-go is whether a competency framework that's modelled on the RCF will share the same structure and domains as the RCF. And the short answer is no, not necessarily, because it depends on what it's actually being used for and the scope of the framework itself. So as an example, the RCF has a whole domain called research, and that domain covers the competencies and activities related to integrating evidence into practice, but also to actually conducting research and disseminating research. And depending on the workforce and what you're wanting to use the competency framework for, you may or may not want to include those competencies and activities. You may not want to include that domain, or you may want to structure the few competencies and activities that are relevant to that in some other way. So it really is determined on a case-by-case basis. Adapting the RCF core values and beliefs. So Ed emphasised that all of the domains in the RCF really centre on these core values and beliefs, and we designed these to intentionally be broadly relevant across all contexts. Not all competency frameworks include core values and beliefs, although many do, sometimes under the label of something like attitudes. I personally think that they're a nice addition and quite an important addition to a competency framework. These frameworks are a nice platform to really highlight the core values and beliefs that we share as a rehabilitation community, and to make sure that they're communicated to the different members of the rehab community. However, it's always important to critically review all of them and adapt them to reflect the specific priorities and nuances of your context. So that could be through changing some of the language possibly, or even building on the core values and beliefs that are already included in the RCF. It's important at the start to consider the proficiency profile of your workforce. Proficiency profile is really RCF speak for the level of performance that you're actually wanting to convey in your competency framework. The RCF has made a sort of concerted effort to try and capture a real spectrum of proficiency, from those that are working under close supervision and direction, and that are really sort of have an introductory level of knowledge and skills, to those that are really working quite autonomously and have quite a specialist level of knowledge and skills. So it's important to reflect on what are your expectations, what are you wanting to convey in your competency framework, and is it a set standard, or are you wanting to convey a progression across different levels or different standards? There's lots of different ways that competency frameworks can do that. It's not advisable, though, I would say, when you're adapting adapting the RCF to create your own competency framework, to stick strictly to one of the levels. For example, you shouldn't say our competency framework is for a level 3 worker. It's rather better to consider the behaviours and tasks, how the behaviours and tasks are described across those levels, and pick the one on a case-by-case basis that reflects or aligns with the workforce that your competency framework is relevant to. And I'll show you an example of that in a minute. Before I go on, Ed covered this, and so I'll just touch on it briefly to highlight the difference between the competencies and activities. The competencies and the behaviours through which they're expressed are relevant to the whole rehabilitation workforce. An example of one from the practice domain is communicates effectively with the person, their family, and their healthcare team. So you can see how this kind of competency is not going to be profession specific or specialization or setting specific. It's important to anyone delivering any kind of rehabilitation intervention. The activities, on the other hand, are going to be relevant to some workers and not, because they are the different tasks that we perform in our day-to-day work. An example, again, from the practice domain is conducting rehabilitation assessments. And obviously, there's a few tasks underneath that specific activity. So when we come to adapting, that the difference between the two will become quite important. The adaptation, when you're coming to actually selecting the competencies and behaviours that you're going to include in your competency framework, there's really 3 key steps or approaches that you take: extraction, adaptation, and expansion. And I'm going to say that a lot through this presentation, and hopefully you go to sleep tonight and it's just rolling over your head again and again. I know it will be in mine. I'll show you what that actually looks like using an example of a competency and some of the behaviours from the practice domain. And I'm using the practice domain as the example because it's the domain that's most likely to be included across the most number of competency frameworks, context-specific competency frameworks. So what you see here is competency 4 from the practice domain, which is the competency that addresses problem solving and decision making. So you'll see that there in the first column. And then what you see along the rows is the 3 different behaviours through which that competency is expressed. And you'll see that it's described across each of those 4 levels of proficiency. So it looks a little bit repetitive, but there are key little differences for each level. And you'll see that some of the cells have been highlighted in the pink color. And this is where our hypothetical competency framework developer has actually gone and extracted the behaviors that he or she feels are going to be relevant for their competency framework. So they've decided that in this first behavior, which is about identifying personal, environmental, and health factors when conceptualizing problems and identifying solutions, they felt that how that's expressed at level 2 is most relevant for their workforce. That's what they want to convey in their competency framework. For the next behavior, which is about integrating information from a range of different sources, they like how it's expressed at level 3. They feel that that's most appropriate for their workforce. And similarly, again, for the third behavior. So they've gone through and they've extracted out the behaviors and what level of behavior they want to include. So that's the extract phase. Then you adapt. So we've used a very neutral language in the RCF. We wanted to kind of keep it as simple and as straightforward as possible so that there was less risk of things being lost in interpretation or translation. But you may want to change some of the language yourself, rephrase things, add things in as you feel is needed. So that's the adaptation phase. And then there's the expansion phase or step. And that's where you go, okay, this is described at this still fairly general level. I want to basically communicate that in a more specific way based on my context. Some competency frameworks do this by including performance indicators. So especially when a competency framework's being used in the context of assessment, these are like specific versions of behaviors that show how it would be carried out in a particular scenario. So that's an example of how a behavior might be expanded upon. Now let's have a look at how you would adapt the RCF activities and tasks. The exact same 3 steps apply: extract, adapt, and expand. And let's have a look at the activity about implementing rehabilitation interventions. So you see that activity in the first column there. And then you'll see for this activity, there's 5 tasks associated with it that we describe in the RCF. And again, here our hypothetical competency framework developer has gone through and selected the levels that are most appropriate for their competency framework. What's different here compared to the competencies and behaviors we were just looking at is that you can see this competency framework developer has left out some of the tasks and decided that they are actually not relevant to their workforce. And that's completely appropriate because, as we were saying before, the activities and tasks are relevant to some workers and not others. So, for example, they've left out the task on administering or prescribing pharmacological agents. That's a task that some rehab workers won't at all be involved in at all. So it's quite appropriate just to exclude it. Again, once those specific tasks have been extracted, they then need to be adapted in the same way that the behaviors before were adapted and also expanded. So what will be happening over the course of this year is that we will be adding in quite specific interventions into the RCF underneath each of these tasks, which will provide you with an array of more specific interventions or content that you can select from. In the meantime, you can either add that in yourself or keep it at a slightly more general level. The level of specificity that you need depends on how you're going to use your competency framework and whether those applications require a certain level of specificity. Adapting the RCF knowledge and skills, just to remind you that the knowledge and skills in the RCF are, there are core knowledge and skills, and there are, which apply to the whole rehab workforce, and activity-specific knowledge and skills. And obviously, which knowledge and skills you pick will depend on which activities you've extracted during the previous step. Again, not all competency frameworks include knowledge and skills. Whether you do or not really depends on how you're going to be using your competency framework. Certainly in the context of education, it makes a lot of sense to, but there might be other instances where it's not necessary. So you have to kind of really evaluate that for yourself. But again, the process remains the same. Extract those that are relevant, adapt them to reflect the language or the situation, and then expand on them. You can be a lot more, the knowledge and skills as described in the RCF kind of act as signposts for the areas of knowledge and skills, but you can expand a lot on those as is relevant to your context. Moving on to phase 3, and we'll move through these ones a little bit quicker. Phase 3 is where you're gathering peer review on your draft competency framework. And you should really anticipate that there might be multiple rounds of feedback and accommodate that in your timeline. And because it's an important phase. It serves to both improve the quality of your framework, but it's actually also a really important way that you can build ownership of the framework and raise awareness of the work that's been done. But it's important to consider the type of feedback you want. Are you just wanting feedback on the accuracy of the content, or are you wanting to know about the usability or the comprehensibility of the framework? So think about what kind of feedback you want and also how you're going to collect it. It can be really useful to have feedback forms sent with the competency framework at this stage, and we've included an example or a template of that within an annex of the adaptation guide. The fourth phase is finalization. So this is really where you're integrating all of that feedback and firming up the competency framework. It can also sometimes be where you're looking to get endorsement from associations or institutions. It can be hard to build consensus around something like a competency framework sometimes because it involves or it relates to so many people. So it can be useful to really consider your decision-making mechanisms and have predetermined how decisions will actually be made. And finally, the dissemination phase it's as important as any of the other phases. It's useful to have a plan around this and really think about the events and platforms that you're going to use to promote your framework, and make sure that people really know how it's relevant to them and how it should be used, and consider whether they actually have the tools that they need to use the competency framework as you've intended them to. So sometimes that will mean publishing the competency framework along with other resources like assessment checklists or any other kind of format. And then consider whether there are barriers to people accessing it. For example, is it easy to find online for those people that will be looking for it? And can it be downloaded or printed easier? There's very practical questions that are well worth considering in the dissemination phase. A few little take-home messages. As I emphasized at the start, frameworks that are modeled on the RCF can all look very different from each other, and that's perfectly okay. And secondly, I want to just, it feels ridiculous to have to say it, but I feel like it is from some of the work that I've seen floating around in the world. Don't create a competency framework just for the sake of it. Make sure that there are very specific applications in mind and design your framework around these, and make sure that you invest in its application as much as you do in its development. And finally, please share your frameworks with us if they're modeled on the RCF. We'd love to see what you've done, and we'd also love to know how you found that application guide. You'll see that it is published as a version for field testing, and we're very open to making changes so that it's as usable as possible. So you can get in touch with us using our email address, which is rehabilitation@who.int. But I will leave it there. Back to you, Satish.
Thank you, Judy. Thank you very much. And thanks for clearly explaining us of how to adopt and adapt the RCF to a specific context, and also defining the 5 phases, starting from planning to drafting to review, finalization, and dissemination. As you said rightly, I think the underlining mantra around all this was extraction, adoption, and expansion. And the last thing, which is what you said, was extremely relevant. Just don't create the framework for the sake of creating it. We need to be sure what is the specific application in mind of the competency framework, because that has an impact on the type of feature it has, on how it is designed, and how much specificity it may have. And I think that lays down a foundation for introducing my next speaker, which is Stacey Baldock, who will help us to tell how to do it right. What are the key considerations to take in mind, and what are the good practices in competency framework development? Stacey is a manager for professional standards for Speech Pathology Australia, and has experience in supporting professional associations in other countries develop university accreditation system. Stacey has been deeply involved in recent update of the Speech Pathology Australia competency standards, and will draw on that experience to highlight some of the key consideration and good practices in competency framework development. Over to you, Stacey.
Thank you, and thank you to all for listening. I guess as the last speaker for this evening, I need to actually extract, adapt, and expand. So as the last speaker, I've been in the background thinking, how do I now need to modify my presentation to make it more relevant to the context? So just bear with me one moment whilst I just share my screen. Okay. So thank you for the introduction. So just a little bit about why I'm here. I'm talking about, we've just recently undergone a very large review to update our competency standards. So I'm hoping that I can share some learnings for you to take forward, and so you can build those into your contexts. So a little bit about, a little bit about Speech Pathology Australia. So it's the national peak body for the speech pathology profession in Australia, and we have about over 11,000 members. And so speech pathologists, or speech language therapists, as they're also known in some countries, support every individual's right to optimal communication and swallowing. The profession has been led for many years, since 1994, with our competency-based occupational standards for speech pathologists, and they were standards that defined the knowledge, skills, and attributes required for entry-level graduates. Now, they're developed in 1994, they're updated in 2001, they're updated in 2011, they're updated in 2017, and then we said, hang on a minute, there's so many things have changed across the world, so many things have changed with our scope of practice. We had multiple drivers to say, we need to undertake a major review. We had feedback from consumers, and we had feedback from members saying they couldn't see themselves anymore. Things had changed. So we embarked on a major review, and I should say that we started and nearly completed our review prior to our knowledge of the RCF. And so it is, you know, when we received the RCF, you know, I had my hand on my heart going, oh my gosh, you know, I'm hoping what we've done is that hopefully, you know, meets the standards that are acceptable across the world. And I was pleased to say that our processes that we put in place somewhat mirrored the processes recommended by the RCF. So I'm hoping tonight that I can, or tonight or this morning, depending where you are, to share with you some of the learnings though that we gathered from that. One of the key things I wanted to highlight through our journey, I'm not talking about our competency standards or our process, but one of the important first steps that's been spoken about with the RCF is, you know, to undertake, you know, look at the evidence and the literature and, you know, ensure that your approach going forward is robust and rigorous. And part of our journey was that we could see many competency frameworks and standards have been developed in Australia within accreditation programs, across health systems and overseas, but it was very hard for us to find information on how they did it. Everyone was doing it, but we couldn't actually find clear information or anything that was published. It wasn't replicable. There wasn't enough detail in there. So it is quite pleasing to actually see the RCF come to fruition to guide people in this space so that you're not necessarily going, well, how are we going to do it and starting from scratch? I'm pleased to say our resultant document, whilst it's not called, it's named a bit differently, but we won't go into that discussion. It's not called competency, it's called the professional standards. We have a very similar result, but there are differences. And it's pleasing to hear Jodie and other people talking about you do need to adapt your context, and that's why there are differences. Ours has been adapted to the Australian context. So I just wanted to talk a little bit about, in the RCF, it talks about good practices involve stakeholder engagement. And I think we all, as a given, know we have to talk to our stakeholders. But how do you do that? How do you get success? You know, how do you actually get people to the table when there is no financial reward? It's about, we just want to share your views, we want to hear from you, but we want to hear from multiple people, and it might be an iterative process. So we want to hear from you again and again. So the way we went forward with our process, we built in stakeholder engagement into our governance structure. And so our governance structure, if you look at the diagram on the screen, consisted of a reference group down the bottom, which was a very large group that involved practitioners across many states, territories, health contexts. And they were like our think tank. And they came together and they were the people that gave us the information on the ground. How do I engage with these people in this area of work? What are the issues that are relevant to them? How should we form questions? What would be relevant to their context? They were the broad think tank. From that think tank, we would take their ideas and push them up to 2 formal committees. And those committees were our Aboriginal Torres Strait Islander Advisory Committee. And so that consisted of speech pathologists who were Aboriginal Torres Strait Islander peoples. It consisted of consumers. It consisted of academics. It was a whole range of people's backgrounds, but they were all from Aboriginal Torres Strait Islander backgrounds. We also had a Professional Standards Advisory Committee, and that committee, again, stakeholders, they were senior members across the profession, academics, senior policymakers. They worked across education, health, or otherwise. Those 2 committees formed the recommendations to go forward. They gave us the advice in terms of how to be culturally appropriate when we're engaging with different stakeholders. What were the key issues that we needed to undertake? How do we engage in some of the sectors? And all those recommendations then went up to our board, which is a volunteer board, who are also our stakeholders. So we built in stakeholder the stakeholders were our stakeholders, which is our governance structure, was informing our process. And one key element of all of our stakeholder engagement was built upon thinking about our ethical values, and these are embedded into our code of ethics. I've just summarised the key ones there. Now, if you're going to go forward with a stakeholder consultation and you're going to be asking your profession, you're going to be asking consumers of your service, you're going to be asking managers questions, then you might get responses back that might be uncomfortable for you to hear, or you might actually cause some level of distress with people sharing their experiences or views. So it's important for us to consider, well, how are we actually going to manage that within our stakeholder consultation? And so when I mentioned before, we searched high and low for examples of how did actually people undertake their stakeholder consultations to form their competency frameworks. We couldn't find some of that information, but we felt that we needed to build that in. And we did follow up on every person that expressed a negative opinion or expressed concern or asked for feedback through the stakeholder process. We followed them up. And we are talking about that we spoke to, over 1,500 speech pathologists responded to our surveys. We had consumers responding, and we also had a whole range of different focus groups as well. So we ensured that we stayed on that pathway. Just moving on. So just thinking about another key factor in the RCF, it talks about implementation. And implementation in terms of success factors in the RCF talks about, embed the whole concepts of access, endorsement and promotion. So think about how you're going to make your documents accessible. Think about who's going to endorse them, who's going to, say that this is a great thing, you should get on board. Think about how you're going to promote it in terms of what media or otherwise. Now, I feel that our success with our implementation again was from our governance structure, because our stakeholders were telling us how to go forward. Our stakeholders were telling us what they needed so that they could understand and so that they could make changes. And so our implementation process consisted of a period of introduction and socialization. So here it is, have a look, read it, talk to people about it, engage with it, no expectations on the membership, just get familiar. Then we moved through a period of transition where it's about, okay, now we want the members to actually start asking some questions and reflecting on it and talking a bit more, and then moving forward to implementation. And again, right throughout that implementation process, we had in the background our ethical values, and that if there was issues raised, we managed it. We spoke to people, we moved on, and we basically had to do some of this extract, adapt and expand as well as people were actually asking different questions. Now, what I wanted to highlight through this process was that originally when we were doing the introducing and the socialisation, a lot of those activities were driven by Speech Pathology Australia and our governance team. So yes, it was informed by all those stakeholders, but we were pushing it out there. So come and read this, come to our live Q&A. But as we went through the journey, sorry, I should just say that stakeholders were saying we needed multimedias as well. So we needed self-directed learning packages. So going back to the RCF good principles with respect to access, providing it in different forms. Then we were moving to transitioning. We were finding that we were collaborating with the membership about how to support their learning. So it wasn't just driven by sort of the SPA leadership and governance team. The membership was actually saying, this is what we want. And they started doing activities in this transition phase, which was really important for that longer term success. We had students contacting Speech Pathology Australia saying, we know the professional standards is coming out and will be required soon. We want to do an assignment on it. We want to interview you. We had members saying, could you come along and be part of our forum? We've got the Department of Education. Could you come along and talk to us about it? They're reaching out, asking questions and forming discussion groups, which was absolutely fantastic. And then as we moved to implementation, we had members saying, can we share what we're doing in this space? And so through this whole implementation process, when we're talking about, good principles around access, good principles are around endorsement, and good principles are around how you promote, we had the members promoting it. So we didn't have to, originally we had, the academics saying it's wonderful. We had, high level people in senior sector saying it's great. And then come to sort of that implementation final phase, we had the members saying, I can see myself in these standards. I know what I need to do in this space. This is how we're actually going to implement it into our practice. So there was a real shift and journey. So I don't have the luxury of time. I was only given 10 minutes to put a 2-year project down into 10 minutes to share my learnings. So I do need to keep to time. But going back to some of the stages that Jodie-Ann has spoken to in terms of, that first phase in terms of, knowing why you're doing it. So whilst I mentioned before, Speech Pathology Australia undertook this task because there was overwhelming feedback that our standards were outdated, we needed to move on. But the reality is we were doing this for the people that we serve. And so we needed to make changes so that for the 1.2 million people in Australia with communication needs, that we were producing graduates with appropriate knowledge, skills and attributes. And similarly for the over the 1 million people with swallowing needs, we needed to produce graduates that had the right knowledge, skills and attributes. In terms of good practices, if you're picking up the RCF, there's some wonderful themes in there that need to go across your whole planning. And how you use stakeholders is really important, and how you start planning your implementation. Now, we always say, we always have to have implementation as the end goal in the early phases. You also have to be flexible because things change. And one big change for us in this journey was that we went from competency standards, which only defined entry-level graduates, to the membership saying, that's not good enough. We want standards for the whole profession. Write them so that for the whole profession. And so then Jodie-Ann's talking about, how do you actually tweak and change things? Sorry about my language use, I'm not using the exact words there, Jodie-Ann, for certain contexts. So we say these standards are for the whole profession, but they're only relevant for the context that you are working in. So if you are not working in a research role, the standards around research do not apply to you. And so they're written in a holistic manner. This is what all speech pathologists should be undertaking at any point in time in their career, relevant to their work context. The other things I just wanted to highlight in terms of good practices, governance is not just about ticking off milestones and checking money. Governance is about ensuring that there's integration, there's appropriate stakeholder engagement, that you're appropriate with your journey going forward. Your governance needs to be founded on ethical values. And you need to share the knowledge. And I'm so pleased to be here tonight because I'm hoping that I'll walk away and help someone with their journey, because I know from our perspective, it was a hard journey, not necessarily having access to other people's stories and how they went forward. And my little picture there at the end, picture of people jumping out of the plane, I guess just to say that you don't get to this point in time, you don't finish a set of competency standards without many, many different people with different skill sets, with different goals in mind to create, the final activity. And whilst these skydivers haven't yet joined arms, there was a lot of other people involved before they could all actually get together. If you think of all the knowledge that had to go in place to build a plane, to put petrol in the car, petrol in the plane, to pilot the plane, and to actually coordinate this event. Developing competency standards needs a broad breadth of people involved as well. So thank you for listening.
Thank you very much, Stacey. Thank you very much. And I think what you highlighted was understanding the big picture, understanding the context, and ensuring that there is stakeholder engagement, collaboration, involvement, and really moving towards having an inclusive approach while working on a competency framework or a professional standard document. And I think what clearly came out from your presentation in light of this session, or in light of this training session, is that competency framework can be used in the context of rehabilitation workforce collectively or for subset of workforce, like specific professions like you just described about speech pathology work in Australia. With that, I move to the question answer. I'm mindful that we are overshooting with the time a little bit, and I'm seeing a lot of questions coming in, but I will take one question, which I see as one of the most challenging one. Okay, so this is for you, Judy. We heard all the good things about RCF. In your opinion, or in your perspective, somebody was driving the whole work around rehabilitation competency framework. What are the weaknesses of the framework which you see? What are the main concerns you see as we are moving towards the implementation phase? Over to you, Julie.
It is a challenging question. I would say in its current form, one of the weaknesses is that the RCF isn't reaching, giving people options for as broad a range of specificity as we would like. And I mentioned during my presentation that we're working on that over the course of this year and hope to, by the start of 2022, have a whole lot of more specific tasks within the practice domain, which will facilitate the development of context-specific competency frameworks that want to go into that extra bit of specificity. But I think not so much a weakness, but a risk, a real risk with the competency framework is that people look to it as something they can copy and paste across. And what we really didn't want to create or promote is a cookie cutter approach where people just sort of take it and apply it sort of as it is. And that's why we wanted to really emphasize this adaptation process today. It really does need to be customized to the people and the places and the cultures in which it's going to be applied. So not so much a weakness, but definitely a risk that's associated with it.
Thank you, Judy. And also, if I can also add over here, and I think as we are moving towards the implementation phase and as we are moving towards adoption and expansion of rehabilitation competency framework in the countries, I think what I can also add to what you said, Judy, to the participant is, please use the country offices, World Health Organization, WHO country offices, wherever they are, to tell them that there's a competency framework. We need to work on this together so that we can develop better competency in that particular country with ministries and the government counterparts. So please use also this as an advocacy tool to influence the professional standards, to influence the competency framework in the countries. Please use stakeholders, and Stacey mentioned some very good examples on stakeholder engagement. Talk to your government counterparts, talk to your professional associations, wherever they are. Knock and try to get the WHO country offices involved in this whole process to ensure that we can really make the difference in the countries with this competency framework. There are some more questions, and I'm not going to take them in light of the time, but I think this ends up well to move towards the closing. We have overshoot it by 3 minutes, but we'll move towards the end. Judy, over to you for the closing. And if we can,
I will take that, and
okay.
Satish, if I may, also because I cannot control myself by really taking the opportunity at the end to thank still the almost 300 participants that are with us. And we have still 2 minutes, Satish, and I think that is enough and provide the space to thank first of all the participants. I also would like to give the floor briefly to Jody, because we have another webinar coming, and I think it is important for everyone to know. Jody, please.
Sure. So that's right. We have a second and for now final training webinar on the 25th of March, so that in 2 weeks' time exactly, at the same time as this one. And that webinar is going to focus on how you can use competency frameworks when you're developing rehabilitation education programs and their curricula. So it's one of the key applications of competency frameworks. And we've got a really fantastic lineup of speakers for that one, people with a lot of really practical experience in actually doing this process. So it'll be good. Make sure you register. We'll be sending the link around in an email in the coming days. And if I can also just sneakily add in, Satish mentioned we didn't get to answer a lot of the questions that came through because of time, but looking through them, a lot of them are actually already addressed in the FAQs page that we created, which is now on the RCF webpage. So please take the time to go over there, and you'll probably find your question has already been addressed in that document. Thanks, Lakos.
Great, thank you, Jody. And then thank you also to Satish for really moderating the whole webinar. It's fantastic, and especially my thanks to all the speakers. It has been fascinating hearing to you, and I'm sure that I speak for all the participants. We have learned a lot, and you have provided a great basis now to move the work forward. So thank you. Have a wonderful rest of the week and good rest of the day for some and good night for others. Bye-bye. Thank you.
Thank you.